Today I will talk about ulcerative colitis. So let me break it down. So colitis means inflammation in the Hello everyone and Assalamu alaikum. This is Dr. Mawadda and today I will talk about ulcerative colitis. So let me break it down. So colitis means inflammation in the colon. And this inflammation is presenting in ulcers. It affects the mucosa and the submucosa of the rectum. Hello everyone and Assalamu alaikum. This is Dr. Mawadda and today I will talk about ulcerative colitis. So let me break it down. So colitis means inflammation in the colon. And this inflammation is presenting in ulcers. It affects the mucosa and the submucosa of the rectum and colon. The ulcerative colitis always starts in the rectum and goes up to the colon. For 90% of the ulcerative colitis, it remains in the rectum. Ulcerative colitis is the most common type of bowel inflammatory diseases. It affects around 160 people from 100,000 people. Ulcerative colitis, or UC, represents in different stages in the patients. Some patients represent with severe ulcerative colitis, where others represent with mild stage. Ulcerative colitis were found mostly on the European Jewish and Caucasians, whereas it was rarely seen in Asia or the Eastern countries. It was mostly seen in young adults from 20 to 40 years in America. So the main cause of ulcerative colitis is still unclear, but many studies suggest that is an autoimmune disease with environmental and genetic stimuli. 10% of the patients had a first-degree relative with inflammatory bowel disease. Other studies shows that kids who was born and raised in Asia and then moved to the UK had an increased probability of ulcerative colitis, as the inflammation invades the colon and the rectum. This will cause an irritation in the wall of the colon, leading to a blood in the stool. This inflammation is causing a type of dysfunctioning in the colon, leading to malabsorption of the water and diarrhea. So patients normally present with bloody diarrhea. In severe cases of losing blood, this will cause anemia, hypovolemia, and tachycardia in order to compensate this blood loss. Ulcerative colitis will present with inflammatory signs like fever, fatigue, systematic illnesses, abdominal pain, fever, and loss of appetite. Under the microscope, ulcerative colitis will present with polyp-like structures, inflammation, dysplasia, which can be low-grade or high-grade. Sometimes dysplasia associated with lesions can appear or strictures. Strictures can lead us to carcinoma. Here are some complications of the ulcerative colitis. It can present with toxic dilatation or megacolon, the perforation, or hemorrhage. In later stages, ulcerative colitis can present with cancer and extracolon signs. By the way, smoking is protective in ulcerative colitis, but never smoke. In addition to inflammation in the colon, ulcerative colitis presents with polyarthritis, which is an inflammation in the large joints, uveitis, which is an ocular inflammation, erythema on the skin, and larger bowel inflammation like cholangitis. Ulcerative colitis, you need to use colonoscopy to see the ulcers and to get the biopsy. Plain abdominal X-ray or CT or MRI are also common to use. CT has replaced barium enema. Patients with ulcerative colitis should go through bacteriology, which means studying of the bacteria in their colon in order to eliminate other types of colitis. Differential diagnoses of ulcerative colitis are dysentery and Crohn's disease. I will get into the difference between ulcerative colitis and Crohn's disease. Ulcerative colitis will have a higher chance to turn into carcinoma. For example, for the first 10 years, the chance will be 1%, and for the 20 years, the chance will be 10%. Let's now go through the management of ulcerative colitis. Some patients may need oral NSAIDs or local steroids, where other patients in acute phase may need surgery. Here are the indications for surgery in ulcerative colitis. We will go through them in another video. Here we can see the different stages of ulcerative colitis. Going from mild to severe stages, the signs will be different and the management will be different. So we'll go through them in another video. Here we can see the different stages of ulcerative colitis. Going from mild to severe stages, the signs will be different and the management will be different. So let's see here. Different stages are categorized into different bowel movements. So if the patient has 4 or less bowel movements a day, he will be classified as a mild stage. Mild ulcerative colitis has a normal ESR and it's not associated with any sign of toxicity. Patients with moderate ulcerative colitis will have more than 4 bowel movements a day. They will have a mild anemia, abdominal pain, and lab tests will show inflammation. Patients with severe ulcerative colitis will have a worse case. They will suffer from anemia, tachycardia, fever, and all kind of systematic inflammation with low levels of protein. The last and the fourth type of ulcerative colitis is the most dangerous. It requires definite surgery and emergency. It's associated with toxic megacolon, which can perforate and cause an acute abdominal pain.